Welcome to my channel. My name is Olivia. I am a board certified nurse practitioner and I work in primary care. A bit about the COVID-19. I'm going to talk to you a little bit about the current guidelines as well as what LA County Department of Public Health has been recommending for people who may be affected. So let's go jump on into it. I'm going to go over a couple of days of work this past week with you. I'm going to talk to you a little bit about what it was like each day, and also LA Department of Public Health has been putting out 2 providers, doctors, nurse practitioners, PAs, to kind of help people guide the patients. Today is March 14th. Very important to note because things will be changing very quickly. I think next week we will have a lot more information. So I just arrived at work, just parking. Things at work have been a little bit crazy, obviously. Obviously, people are coming in more worried, and we'll see if the health department send us any new updates, and I will keep you updated about what the current LA County guidelines are for testing. So one good resource is this website. It's called publichealth.lacounty.gov. And every day it updates. Yesterday we had 17 cases, and it's now up to 28. And we have 1 death in LA County. It can also give you information. I will go over the guidelines for healthcare professionals, including the identification of people who are candidates for testing. Oh, it just updated. Oh, March 11th. Okay, so we have a new update. I'll print it out. So here we have these guidelines for today. They came out last night. Very exciting, a lot longer than they were. And I don't even know how I survived. I won't make it to the show without your love. So page 1, not very exciting. It's just a checklist trying to screen phone number you call for LA County. You get put on hold if you call it, just to let you know, and then they call you back, because I called it this week. And so basically, so we're going to move on to page 2, the interesting part. Page 2 and 3 are the testing criteria pages. So first scenario 1, fever or signs of lower respiratory illness like cough or shortness of breath. So you could have just a fever and a confirmed contact. Any person who has in the last 14 days of symptom onset has had close contact with a suspect of a COVID-19 patient. So what does this mean? So you have either fever and someone you know who was confirmed positive, or a cough and someone you know who was confirmed positive. So 2 is fever and signs and symptom of a community-acquired lower respiratory illness, cough or shortness of breath, requiring hospitalization. So this one is not for anyone in a clinic. So fever and the cough and a history of travel. So you have to have 3 for scenario 2. So you have a history of travel from the geographic areas of China, Iran, Italy, Japan, South Korea, and all these symptoms. That would be testing number 2. 3 is fever and signs and symptoms of cough and shortness of breath, and you're a healthcare worker without an alternative diagnosis. It says, for example, negative molecular respiratory panel, meaning so they already did like flu testing, influenza testing, which is silly because you probably already had the flu shot if you're a healthcare worker. But you have to have all 3 for scenario 3. You have fever and cough, shortness of breath, and you're a healthcare worker. So if you're just a fever and a healthcare worker without an alternative diagnosis, that wouldn't meet the criteria. Scenario 4 is a lot like scenario 2. it's fever and signs and symptoms of a cough or shortness of breath requiring hospitalization, so nobody in the clinic, and history of travel in the last 14 days from China, Iran, Italy, Japan, and South Korea. Or, so you could have the fever and the symptoms, and then you have to have either the travel history or some sort of radiographic findings compatible with a viral pneumonia and no alternative diagnosis. So that means that they've ruled out bacterial pneumonia, because with pneumonia, right, you have the bacterial and you have the viral pneumonia. So some are caused by bacteria and we treat those with antibiotics, and others are viral. So those are not treated with antibiotics. So radiological findings could be something like your CT of chest has those appearances on your lungs that look like something that they don't know what it exactly is. So scenario 4 is part of a cluster of 2 or more cases of an acute respiratory illness within a 72-hour period, and you live in a congregate living situation. So what is that? That is like a skilled nursing, so like an older or senior living home, a homeless shelter, like a place where a lot of people live. Could be a jail. But if there is 2 or more cases of respiratory illness in a 72-hour period and you're in a group home setting, that would be scenario 4. This one is the most interesting by far because it gives a lot of clinical judgment to the providers, the doctors and the nurses, to decide if testing is available, if we think that you should have it or not. And this was the new part for that just came out this past Wednesday, that kind of looked at something that we didn't have this scenario prior. So you have to have fever and signs and symptoms of a lower respiratory illness, cough, shortness of breath, not requiring hospitalization, so you have the clinic. And now here's the interesting part. You can have either clinical judgment, risk factors as indicated by history and clinical judgment, like you already did a rapid influenza and it was negative, or you have a history of travel from an affected geographical area in the last 14 days. So this one is a little different because it gives the clinic nurses and doctors more say about what they think. Clinical judgment could be like, I'm really worried about this person because they have other risk factors, or I think this person needs more testing. So, okay, so it's Friday. Yesterday was interesting work day. Pretty slow actually. Not a lot of people coming in. So let's see how the day shakes out. So far so good. Just hoping that we get test kits sooner rather than later. And yeah, let's see if there's anything new from the county. So we'll refresh the page from last night. Let's see here. 32 up from 28, still 1 death. And this is the website again. publichealth.lacounty.gov. Now it's the end of the day on a Friday the 13th, and we'll refresh the page, and 8 more cases in 8 hours. So to summarize, I think we've gotten a lot of guidelines from the county, and we continue to get guidelines from public health. They're not exactly everything we want right now, but I think that they're gonna increase, and I think we should still work out. We should still do the things that we need to do, eat healthy, and do what you can. Practice good hand hygiene and do what you can day to day. Look at those calves, yeah. don't get too scared or frustrated by what you're seeing and hearing in the media, because a lot of places are giving this sensationalized information that's just kind of running away with our fears. So overall, like, the last question is, when will we get our kits, like our testing kits? And so far we don't know, but we think this week we're going to get everything that we need from the CDC, test kits and more information. Obviously the guidelines are going to update every week, so I will keep you updated. If you feel like you have a slight cough and you may be not feeling too well, I wouldn't panic yet, because keep in mind, there's still seasonal flu. There's still bronchitis. There's still random illnesses going around. And you probably don't have something dangerous if you're a little bit sick. Thanks for watching.